Ladies and gentlemen, you are welcome to Eye Movement Desensitization and Reprocessing EMDR, a short presentation. I'm Dr. Tettey Doe in the United Kingdom. What is EMDR? It is a psychotherapy treatment that was originally designed to alleviate distress associated with traumatic memories. Shapiro's adaptive information processing model posits that EMDR therapy facilitates assessing, processing of traumatic memories and other adverse life experiences to bring these to an adaptive resolution. After successful treatment with EMDR therapy, affective distress is relieved, negative beliefs are reformulated, and physiological arousal is reduced. During EMDR therapy, the client attends to emotionally disturbing material in brief sequential doses while simultaneously focusing on an external stimulus. Therapist-directed lateral eye movements are the most commonly used external stimulus, but a variety of other stimuli, including hand tapping and audio stimulation, are often used. Shapiro hypothesizes that EMDR therapy facilitates the accessing of traumatic memory networks so that information processing is enhanced with new associations forged between the traumatic memory and more adaptive memories or information. These new associations are thought to result in complete information processing, new learning, elimination of emotional distress, and development of cognitive insights. EMDR therapy uses a three-pronged protocol. 1. Past events that have laid the groundwork for dysfunction are processed, forging new associative links with adaptive information. 2. The current circumstances that elicit distress are targeted, and internal and external triggers are desensitized. 3. Imaginal templates of future events are incorporated to assist the client in acquiring the skills needed for adaptive functioning. A general overview for non-clinicians or the layperson. EMDR, eye movement desensitization and reprocessing, is a psychotherapy that enables people to heal from the symptoms and emotional distress that are the result of disturbing life experiences. Repeated studies show that by using EMDR therapy, people can experience the benefits of psychotherapy that once took years to make a difference. It is widely assumed that severe emotional pain requires long time to heal. EMDR therapy shows that the mind can in fact heal from psychological trauma as much as the body recovers from physical trauma. When you cut your hand, your body works to close the wound. If a foreign object or repeated injury irritates the wound, it causes pain. Once the block is removed, healing resumes. EMDR therapy demonstrates that a similar sequence of events occurs with mental processes. The brain information processing system naturally moves toward mental health. If the system is blocked or imbalanced by the impact of a disturbing event, the emotional wound festers and can cause intense suffering. Once the block is removed, healing resumes, Using the detailed protocols and procedures learned in EMDR therapy training sessions, clinicians can help clients activate their natural healing processes. Some research studies. More than 30 positive controlled outcome studies have been done on EMDR therapy. Some of the studies show that 84 to 90% of single trauma victims no longer have post-traumatic stress disorder after only 3 90-minute sessions. Another study funded by HMO Kaiser Permanente found that 100% of single trauma victims and 77% of multiple trauma victims no longer were diagnosed with PTSD after only 6 50-minute sessions. In another study, 77% of combat veterans were free of PTSD after a number of sessions. Now, treatment impact globally. There has been so much research on EMDR therapy that it is now recognized as an effective form of treatment for trauma and other disturbing experiences by organizations such as American Psychiatric Association, the WHO, and Department of Defense. Given the worldwide recognition as an effective treatment of trauma, you can easily see how EMDR therapy will be effective in treating the everyday memories that are the reason people have low self-esteem, feelings of powerlessness, and all the myriad problems that bring them in for therapy. Over 100,000 clinicians throughout the world use the therapy, and millions of people have been treated successfully over the past 25 years. EMDR therapy is an 8-phase treatment, which will not go into details in this presentation. Eye movements or other bilateral stimulation are used during one part of the session. After the clinician has determined which memory to target first, he asks the client to hold different aspects of that event or thought in mind and to use his eyes to track the therapist's hand as it moves back and forth across the client's field of vision. As this happens, for reasons believed by a Harvard researcher to be connected with the biological mechanisms involved in rapid eye movements, sleep, internal associations arise, and the client begins to process the memory and disturbing feelings. In successful EMDR therapy, the meaning of painful events is transformed on an emotional level. For instance, a rape victim shifts from feeling horror and self-disgust to holding the firm belief that I survived it and I am strong. Client's own insights. Unlike talk therapy, the insights clients gain in EMDR therapy result not so much from clinician interpretation, but from the client's own accelerated intellectual and emotional processes. The net effect is that clients conclude EMDR therapy feeling empowered by the very experiences that once debased them. Their wounds have not just closed, they have transformed. As a natural outcome of the EMDR therapeutic process, clients' thoughts, feelings, and behavior are all robust indicators of emotional health and resolution, all without speaking in detail or doing homework used in other therapies. Thank you for your attention. I wish you all the best in your careers.